getting on FYP is important, like I said, just so we can get more people. Y'all, I'm not into this for the money. I'm wanting to reach people to let them know that they're loved, they're cared, and they're seen. And that they have a safe place to go Tuesday nights and Thursday nights. And Dixie and Karen they do, my mods do just an incredible job at that. The other standard things that I need to get just put on a recording as well. Rule number one, no politics, please. There are 10,000 pages on TikTok and growing. It's just politics of all different flavors. I firmly believe that as invisible folks, we have enough going on that we can take an hour and a half, whatever break away from that, and the world won't end. So let's leave that off the table tonight if we can. Number two, no drama llamas, please. Again, we have enough stuff going on. Let's leave the outside dramas be for a little bit and really just take the mask off and just let everything down. Everybody here is safe. Everybody here is respected and appreciated. And let's just do our best to keep it that way. All right. I got a comment today from a gentleman that I haven't even talked to. And he said that this is what this group needs is, thank you, Sherry. I appreciate you. That needs a safe place to go. And that's what Amanda and I stress, is a safe place. And if we can get together and have conversations and everybody learn something to be a little bit more successful, that's even extra bonus. So, all right, I'm good off that soapbox for the time being. Introductions. You know me, my name's Keith. I'm not a doctor. Nothing I say should be taken as medical advice. The only license I have is to drive a car in the state of Texas. Amanda, care to introduce yourself?
Hi, I'm Amanda. I am a 14-year legacy chronic pain patient and a mental health advocate, and I'm just glad to be here tonight.
And then we have the guest of honor. We have Miss Joleen, Mama of Chihuahua Mafia.
I am a wife, mom, grandma, dog mom, and a life insurance agent. I have been a chronic pain patient. I mean, it really started when I was 12 years old, and I can go more into that.
Okay. So, and you keep yourself pretty busy with animals and with kids and running a household, and yet you deal with some incredible issues. And
I'm currently raising 2 grandchildren so my birth children are grown. They're 27 and 20. My husband had a son when he was 16, and that son started procreating when he was 15. Oh, and wow. So for the past almost 10 years, it'll be 10 years, December 5th, I've had 2 of my grandchildren from him. They are 16 and 11. And wow. I have 12 dogs, and 9 of them are Chihuahuas, which hence my name.
Yep.
They're rescues. Yep. But really, they rescued me.
Yeah.
They are my world. And when I felt so abandoned and alone in being sick, they never left my side.
Yeah.
So I have a few of the problem ones in here with me tonight. So if it gets loud, I apologize.
No, you're fine. You're more than fine with that. And I used to think we the most I think we had rescue dogs at one time was 7. And if you're tackling 12, wow. Okay.
The only one that wasn't a rescue was my Great Dane. I purchased her. And I wanted a weight-bearing service dog, but she has such severe anxiety that she cannot be a service dog, but I am her service human.
There you go.
Because of her anxiety. So
we had a Great Dane, and he was just a big lapdog is all he really was. He was. You had to keep a towel in your pocket when you walked around because he drooled, and when he was drinking water, and it was just a disaster because he ate water. Oh my gosh, I don't know what that is, but that's really cute. Whatever that somebody just put across the screen. Thank you for that. So you sent your bio, in a text message, right? And that's the short version.
Oh, that's the very short version.
And just some things off the top of my head. And I'm going to butcher the word, endometriosis.
Endometriosis.
Thank you. That's why I never became a doctor, not because I'm not intelligent, but because I can't pronounce the illnesses. 26 surgeries, right?
Yes.
And like you just said, pain when you're starting at the age of 12. And then on top of that, which I think we'll get to if it's up to you, you have a really rare condition as well.
I do.
But I think you'll agree, I don't have what you have. I'm chronic pain and probably some mental health issues. Okay. According to my new therapist, there's more than a probable cause
Don't
to that.
we all? Oh, I mean, really, don't we all?
We do. She's already looking at new Mercedes. But I can relate to your story through some of the things you've been through. And that's why I think these Thursday nights are so special, is because I've said it 10,000 times. I feel our diagnoses are important to us and our medical care team and our family or our friends. But as an invisible community member, it doesn't matter because we've all had a lot of the same shared experiences, unfortunately. But I think when we get together, we talk about it, we can pick up on maybe some things that you've done or some things that Amanda's done, or maybe Kat throws something out in the comments or Dixie throws something in the comments that we haven't tried before. And at the very least, we walk out of here with a little bit better understanding of each other. So that's another soapbox number 2 already, and we're 15 minutes in. So, all right, so let's start this. I'm going to say I'll start with you had pain starting at the age of 12, and then you can take it from whatever age point you want to go from there. Okay.
It was like 12, 13 when I started my period. I believe I was 12 years old, and my periods immediately were incredibly painful. But because I was a young girl and not knowing that they're not supposed to be painful like that, but they were very painful, very heavy, and I actually ended up seeing an OBGYN when I was 15 because of the pain and the excessive bleeding and all of that. They were never regular, which most people, endometriosis, like we never had regular periods. So that's when that was the first time I remember having really bad pain. And I remember I went to a sleepover, and it was a slumber party at a friend's house. And it was probably my first really bad one. And I was down the whole time. I was in so much pain, but because I was so young, I was embarrassed and I didn't want to say anything. And I had a really terrible time. So I got pregnant at 19 for the first time. So I met my husband when I was 15 years old. I'm 47 now. And we got married, and when I was 19, I got pregnant when I was 19, and it was a horrific pregnancy. Incredibly, my grandmother passed away in February of that year when I was pregnant with my son, and I don't know if it was the stress or the grief or whatever, but I started going into preterm labor. So the remainder of my pregnancy, I was on bed rest, in and out of the hospital. They would, pump me. At one point, they actually were really worried about my contractions. And so when it finally came time for him to come, I labored for 48 hours with no drugs and then had a C-section. So with no medications. Sorry, I'm first TikTok live ever. So
don't worry, you're fine.
Then I had him, and I had him the day after I turned 20. So he and I are 20 years and 1 day apart.
Oh wow!
Wow.
Following that, I continued to have horrific periods, so much pain. I would have laparoscopies, several, to try to clean out the endometriosis. But because I was so young, there wasn't on the table having a hysterectomy yet. And I wanted to hang on to my organs as long as I could. And I had an amazing doctor, my OBGYN, amazing guy. And he would go in and clean it all out and sew me back up. And so I would always have the laparoscopies. They took one ovary first, and then I just had like the excessive bleeding again. I had what's called an endometrial ablation, where they go in and they cauterize the inside of the uterus. That actually worked for me for a few years. It completely stopped the bleeding, but it never stopped the pain.
Yeah.
So after that, after about a few years, I started bleeding again. And so my doctor said, oh, I got pregnant with my daughter in 2003. So my kids are, 6.5 years apart. My pregnancy with her was horrible. I had so because of my first cesarean, my uterus adhered to my abdominal wall, the scar tissue. So I got huge because my body was making so much excess fluid to protect the baby from all of this scar tissue. They thought I was going to have a 9-10 pound baby because of how I was measuring. I had a planned C-section with her. But I was in the hospital my entire pregnancy with her, pain, complications, whole 9 yards. She was 6 pounds when she was born, just an itty bitty little thing. And I was begging my doctor to please take her early, because if she's that big, just please, I already knew I was having a C-section. But prior to, let me back up just a little bit. In the beginning of 2003, I got the first SARS. I came down with severe pneumonia, 90%. I had 10% of my left lung not functioning, or only functioning. And my dad actually, because I went to the ER, and this will kind of go back to explaining why I get so sick. I don't get sick like a normal person. I get sick like an old person. And I was in my 20s, and I was in the hospital. My dad took me. I went with my mom, and they said my lungs were clear, because I told my mom, I have pneumonia, Mom, I can't breathe. And they said my lungs were clear. Exactly 7 days later, I had to be admitted into the ICU. They told my family, we don't know why she's this sick. There's a chance she's not going to survive this. Just prepare yourselves. I was in ICU for quite a while, and I recovered. I believe I was in for about a month.
Oh, wow.
Holy crap.
Yeah. And then when I was in my 20s, I worked at Starbucks. So I don't know where I contracted this, but the fluid in my lungs was so thick they couldn't get it out, because that's kind of like the SARS COVID, where, it's thick. So after that, I got pregnant with my daughter, and I wasn't sure I could ever get pregnant. I had, pretty much resolved to the fact that I was going to have one child, and I was fine with that, because I felt like the whole reason God put me on this earth was to be his mom. He was just my everything. And I got pregnant with my daughter. Following that pregnancy, planned C-section, horrible pregnancy, in and out of the hospital, scar tissue everywhere, a lot of pain. It was a very painful pregnancy, a lot more painful than my first. I had a C-section with her, and then right after, the endometriosis flared back up again, and it was horrible pain. That's when they did the ablations. They'd go in and clean it out. Then they took one ovary. Following that, a couple years, I got some relief, and then I started bleeding again. My doctor did another ablation, and it didn't take. And so I was still just constantly bleeding. I would have 2 to 3 periods a year, and they would be so bad. I would actually Darvocet back in the day. That's what they would prescribe me, because they would lay me out. It was that painful. And then, later I ended up having to have a hysterectomy, but I kept one ovary to, for the hormones, whatever, because if you have endometriosis, you can't go on hormone treatment. Oh. So I didn't want to have to go through all the menopause and everything else. I was young, right. Kept my last ovary. And by the time he finally took my last ovary, it had completely migrated to the other side of my body. It was stuck to my bladder, intestine. There was so much scar tissue that like a 20-minute surgery ended up being a couple hours. He was just in there trying to clean off all of the scar tissue.
Real quick, I just want to just throw something in here. We've done 7 episodes of Invisible No More. And in 7 episodes, you're the second. And people who come on and share their story, it's random, really, right? Mm-hmm. I mean, I don't have like 10,000 and cherry pick. It's just whoever can come on and wants to come on and share. But you're the second one that I know that's had a hysterectomy that early. I remember VJ, and I don't think I'm talking out of school because she said it here, right? When she was 20, had one. And I'll never forget a doctor challenging her on that, saying that they don't do that to people that are young. Mm-hmm. And she had like the file in front of her with the CAT or the MRI results showing. And she was like, look, it just show you there's nothing there anymore, and to have that at such a young age, and to still be strong like you are now, I think that's just a testament to who pain patients are, who invisible patients are. We're just really, you have to be mentally strong at a young age to go through something like that. I would think. I'm a dude, so that's just my opinion, right? And I commend you for that,
My sisters, my youngest sister had a hysterectomy in her early 20s.
Wow. And I'm looking at,
never had any children of her own.
I'm looking at the comments, and it's again, 24 for one, 50, 40, 25, 28, 30. Yeah. And I mean, I'm blue collar dude, right? But to me, I'm just shocked that it happens so frequently. So to people that are, to ladies, women that are they young? So
Polly is my husband. He just came in.
Oh. He's a warrior. I think we're going to get to you talking about that later on.
Yeah.
So, anyway.
Yeah, my sisters had hysterectomies young. My mother had hysterectomies. Her hysterectomy, she was older than all of her daughters, I think, when she had a hysterectomy. I've never had brothers. She just had all girls, and we've all had the same issues. So.
And I think it's crazy. It's just a good one more reminder that when people come out and they share their story, it lets other people know who may not have known, somebody else had this done when I was just young,
And it's mind-blowing that so many women have gone through this, and it's just not talked about that much either.
No.
Yeah.
It's not.
Yeah.
But it seems endometriosis is a common thing in a lot of women that, and you just don't, because we just, as women, we suck it up kind of, it's like, when you've had, when you go through puberty as a young girl and then you have, start your period, you don't have anything to compare it to. So, it's just one of those things that I think a lot of women struggle with, and it's not really.
Yeah. And I could see, as a guy being a dad, they're supposed to hurt and just walking away. Right. And whether that's just because as a kid, as a guy, this is health class back in the day didn't even talk about girls didn't have periods, right? That wasn't something that was even talked about. And when I was in school, I'm dating myself, right? But I could see a dad just innocently saying that, or not trying, toughen up, they're supposed to be rough when you're dealing with this major health issue, so. But anyway, I'm sorry. Keep going. Okay. I hate to interrupt like that, but I wanted to get across that your story just in the comments just proves that people have all this stuff in common, right? So, okay.
And I see it too in the comments. Everyone's like, I had a hysterectomy at 24, I had it at 29, you know. It is a very common thing, but a lot of things that women go through, and I'm not, you know, dogging on men, but there's women, you know, we go through things unmedicated that, you know, really should be medicated, and procedures and things like that. So, so after I had my daughter,
I was saying the main issue is they can't really see it on imaging either. So they actually have to go in laparoscopically to even find out that you have this. And that was my major issue of getting diagnosed. It took me years, almost a decade, to get the right OB-GYN to say, okay, I really do think that you have an issue.
I think what really saved me and my sisters is that we had the same OB-GYN as our mom, and he was well aware of our family history. And he is an amazing, amazing doctor, and I cannot believe he's still practicing. He's an old man, and he is still practicing bedside manner. I mean, just amazing human being.
That's awesome.
He cares about women. He's not one of those, you know. I remember after one of my surgeries, I was crying when I woke up because I was in pain. And the nurse told me I needed to be quiet. I was scaring the other patients in the recovery. And my doctor came out of nowhere. He shouldn't have even been there. You know, but he would check on me, and he ripped into this nurse and he said, "Don't you ever treat my patient like that. Jolene, what's wrong? What hurts?" He was just that kind of guy.
That kind of guy. Yeah.
And I've been really lucky. You know, I have gone through a lot of medical trauma, and I have been treated horrifically in a lot of situations, but I have had a few really good doctors, and I'll mention them in a little bit. And I'm trying not to drag everything out. I'm trying to kind of do a compressed version. So after I went through all of that, I started having like body aches and you know, and I have fibromyalgia, but back then they couldn't really figure out what it was. I just never felt good, tired, lethargic, pain. I felt like someone was compressing my body, and then my nerves would start firing, you know, left and right. And it was horrific pain, and I was diagnosed with fibromyalgia. And that was probably, and I have a brain injury, so my memory kind of goes wonky here and there. But, so you know, fibromyalgia pain, I started with that. I forget what year it was. My daughter I think she was 7. So 2010. I went and got a piercing. I got a dermal piercing right here in my chest. And it looked fine, you know, whatever. One day I woke up, I got really sick. I, you know, went outside, had my cigarette, drank my coffee, came inside. I felt okay when I woke up, and then immediately felt ill. And it was an immediate thing. I got in the shower. I was vomiting everywhere. My daughter-in-law lived here with my oldest grandson at the time, and I called her and I said, something's wrong. And I'm naked in my bed, and this poor girl, she was only 18. I was super high fever, burning up, vomiting everywhere, you know, all of this. She had to call an ambulance. Ambulance came. They couldn't figure out, I was in septic shock. And they couldn't figure out why until my left breast blew up like a balloon. I had cellulitis in my left breast from the dermal piercing, but the infection was inside. On the outside, it looked fine. Oh, wow. So I was in complete septic shock. I was in the hospital for that. And that's what when I get sick, I just get really, really sick. And I've always my immune system because I'm autoimmune. So then after
autoimmune conditions,
I have lots, yeah. So, and then 12 years ago is when my life took a real sudden turn. it started with, I had never had a migraine in my life. I had never, I would get a headache, if I was drinking the night before or whatever, but I never experienced migraines and nosebleeds. I was getting really bad migraines and nosebleeds to the point where they had to cauterize the inside of my nose because it would just constantly bleed. And my migraines were awful. A couple times I had to go into the hospital or into urgent care to the hospital to get a shot for the migraines because they were so bad. And that lasted for a year. It was sudden onset, and then it immediately stopped. It was almost exactly 1 year that I went through, and they never knew why. They never knew what caused it. So then after that, I started having kidney pain. And I didn't know what it was. I was like, oh, my back kind of hurts. And then I was like, and I didn't have any painful urination or anything that would say infection, but I was having extreme kidney pain. And I let it go for about 5 days. And then I thought, you know what? The way I get sick, if I have a kidney infection, I could go septic. I should probably go get this checked out. I went to the emergency room, and they said I had blood and protein in my urine, but no infection. They did all my labs and everything. And then they said, well, we need to do a CT and check for stones because, you don't have an infection. Did a CT, no stones. And they said, we don't know what's causing your kidney pain. You need to see a nephrologist. Gave me a shot of a very mild pain medication, IM, and sent me on my way. So it's not an emergency. You need to see a nephrologist. And while I was searching for a nephrologist, I was praying and I was asking God because I said, you know what? I know my body. I know I'm complex. Send me to someone who can help me. And that's when I met the most amazing doctor I've ever met in my life. His name is Dr. Sunil Patel out here where I live, and he is just phenomenal, and I'll explain why. It makes me want to cry just because he has been just... So I went and I saw him, and the first visit, he told me, I want you to know that your pain is real, and I believe you. And it's really important that you know that.
Wow.
And it was at that point you had to pick yourself up off the floor because you had somebody, the medical, had a doctor that validated that what you were feeling was real. When Amanda and I tell people that sometimes you have to try to find another doctor and just keep searching and keep searching and keep searching and keep searching. Because we've been through having to try to find a doctor. When you find that doctor, all those months or years of searching, that relief, that mental relief you feel, because you're still sick, you're still in pain, you still don't really know what the hell is wrong with you, but the weight of carrying so much is gone. And that's why when we tell people, we don't tell people to go, well, you need a new doctor. We don't. I've never said that flippantly, like it's not a big deal, because I've lived it, right? But that immediate relief is worth the 8 months, or however, for me, however long it is for somebody to find somebody. So, all right. Anyway, so you met your unicorn, and you said, "Hey,
I did.
I believe you. You're hurting."
He said, "I want you to know that your pain is real, and I believe you." And he said, "It's important that you know that." And I at that point, the pain wasn't completely debilitating, but it was affecting my life. It was painful. Kidney pain is like, it is I don't want to say the worst pain in the world. It is the worst pain I've ever felt.
Yeah.
And it's indescribable. And there are times, well, I'll get into that. So I went through about 8 months of diagnostics, and what he would do is he was constantly he would get, and he asked me, at this point, he said, "Do you need something for your pain?" And I said, "Well, I've been taking ibuprofen." And he said, "That's really bad for your kidneys. You shouldn't be taking ibuprofen." And I said, "Well, Tylenol doesn't work." And at that time, he said, well, I'm going to give you some. I mean, he was just, I'm going to give you something. And if you need it, take it. If you don't, don't. And at that time, like, I did not want pain medication. I didn't want to be on meds. And he knew that, like, he could tell that. And he said, well, I'll give you something. If you need it, take it. If you don't, don't. Mm-hmm. And so I said, okay. It was about 8 months of diagnostics. My pain started progressing and it started getting worse. It was both sides, both kidneys. And it would feel like, they would ask me, is it stabbing, throbbing, and I would just say yes, because at times it would feel like someone stabbed me in the kidney out of nowhere and I'd fall to my knees, which is why I wanted a weight-bearing service dog that I could lean on when that happens, because it's happened to me in the grocery store. It's happened to me in the public, in a parking lot. It's like out of nowhere. It literally feels like a knife has been put in my kidney. So, it kept getting worse. And in this 8 months, I would be hospitalized, and he would treat my pain and he would admit me and bring the specialist to me because he didn't want to wait for referrals or anything like that. He would admit me in the hospital and then call for urology consult. He was still trying to figure out what was causing the pain. I went through a kidney biopsy. My mom had to take me because my husband was working and my mom was always there at every surgery anyway. And so she drove me and they said, it's a CT guided kidney biopsy and, they don't put you out for that. What they do is they give you the cocktail of stuff that's supposed to try to make you loopy. But for me, I don't ever experience euphoria. My body doesn't experience euphoria. When I would, in my younger days, when I would drink alcohol, I could drink way more than anybody else and be perfectly fine. I never experienced that. So I was completely awake and I felt it. And the cocktail they gave me did absolutely nothing. So I felt them cut me. I felt them insert their instrument. I felt them grab my kidney and pull a piece. And I kept telling him, I can feel it. I can feel it. And he said, I'm already in. I can't stop. And so when he rolled me back out, my face was white and I was crying. And it takes a lot for me to cry. And my mom was like, what's wrong? And I said, I felt it. I felt all of it. I felt him cut me. I felt him put the instrument in. I felt the whole thing. So kidney biopsy came back. So my doctor was looking for things like IgA nephropathy or nutcracker syndrome. And there's all these diagnoses that I had never even heard of. And a lot of the medical community hasn't either.
Can I go back? Can I go back for just a second?
Yeah.
Was there ever an apology for not knocking you to the point? I have a friend, Tanya, that had some kind of bone test in her hip.
Yeah. It was a bone biopsy.
They promised to knock her out or to give her whatever, and they did the IV and everything, and they never put the meds in. So she didn't have anything either for that, and they didn't, just like your doc didn't stop. Mm-hmm. And then I read a story today about a doctor in Florida who has a hearing issue, and he was doing colonoscopies without sedatives. And one patient was screaming in pain and he couldn't hear it. So he just continued. Nobody in the room told him to stop because he was the doctor.
Yeah.
He got fined. He got fined $7,000 and didn't lose his license, nothing.
Wow.
And he's still doing it. So it's just more, we need to be careful because it happens. And, I can't imagine the feeling of a part being taken off and you're just, all you can do is lay there and try not to move to screw anything out, because you're you're in terror, you know?
When you're already in pain, when your kidneys already hurt and they go rip a piece off of it.
Oh my God.
Horrible. It was one of the most horrific things I've ever been through in my life. It was horrible. And when my mom saw me crying, like she saw, it was sheer terror on my face. It was like,
of course.
I was terrified.
Of course.
Yeah, it was horrible.
Gee. And then there's no all right, I'm sorry. I didn't mean to get us in the weeds, but
Oh, it's okay. It's okay. Yeah, it was pretty bad. It was pretty bad. So that biopsy came back. I had 2 cystoscopies. They did put me to sleep for those, thank God. And that's where they take a small camera, they go through the urethra up into the bladder, and to the ureters, and they were trying to find the source of bleeding, because I bleed from my kidneys in my urine profusely sometimes, gross hematuria where it is all blood when it comes out. I also pass blood clots in my urine. And I've had a couple stones in my life, and it feels the same when you're passing a clot. It is like and I can feel them moving. I know exactly where they're at when they come out of my kidney and they go into my ureter and to my urethra. I can feel all of it.
you can feel it. You can.
Mm-hmm.
I used to get kidney stones like almost monthly because of a condition I have. And you can feel those bastards shifting. I can't imagine on a consistent basis having to pee out blood clots.
Yeah.
Because having to do that on a consistent basis with a kidney stone, just excruciating.
It's indescribable, really.
Yeah. So, wow. So they did the biopsy. They did that.
Mm-hmm.
Did they were there any other tests, or did they find conclusions on what's going on with you? Or
So the biopsy came back inconclusive. There were a lot of irregularities, but not enough to pinpoint a specific diagnosis. And so after 8 months of constant diagnostics, admitting me in the hospital, all of these things, I'll never forget the day that he actually diagnosed me. If I could back up a little bit, when you're sick, it is important to have a diagnosis. That diagnosis is incredibly important. If to no one else, if to yourself, because then there is a label to what is causing your pain, and it's real. Because so many people, people look at me and they don't realize it's insulting, but you look fine. You don't look sick,
because you're invisible.
Yeah.
Your illness is invisible and they can't see it. So that people assume that everything's normal. Right.
So this whole time I'm thinking, I just want to get diagnosed so they can fix me, and I had that in my heart, and I kept praying, and I said, God, just please let them give me a diagnosis so they can fix me. Thinking, if it's broken, they can fix it.
Right.
Unfortunately, what I have, there is no way to fix it. I will never forget when he diagnosed me. He came and he saw me in the hospital. I was in the hospital probably twice a month or more for a week at a time for pain management. And he would send a pain management specialist to see me in the hospital. And this is when he really knew that I was not drug seeking. He sent one pain management specialist to come and see me. And this guy was standing in the doorway and on his phone and not even looking at me, scrolling through something, answering his phone while I'm talking. And he ordered everything under the sun for me. And when I heard what he was ordering for me, I told him, get out. Like, you're trying to I really felt like he was trying to kill me. Mm-hmm. I said, get out. That's way too much. And my nurse came in and she said, okay, you don't have to take all of that. But the positive thing here is that we can try different things to see what works. And that's when I found out exactly what treats my pain, exactly what medication. It starts with a D and it's highly stigmatized. And that is the one medication that will help my pain when I'm in a flare. I used to call them attacks in the beginning, but they're flares. So after 8 months of diagnostics, he came in and he sat down next to my hospital bed and he said, "This is what you have." And it is called loin pain hematuria syndrome. And it is very rare. It's the acronym LPHS. And this is one of the reasons I wanted to do this with you guys, is that any chance I get to discuss the symptoms and everything that I went through with this disease, someone else may be feeling all of this and their doctor is not knowing what it is.
Not knowing. And they'll never admit that they don't know. Well, let me rephrase it because I have to be. A lot of doctors will never admit that they don't know. And that's how I need to say it. I have a good doctor now. Amanda, you've got a pretty good doctor now. You obviously have a good kidney doctor, right? So, I mean, there are good doctors out there, so I can't blanket statement. Dr. Mike he's an MP, right? So technically he's not a doctor. But I mean, so I don't want to say, but a vast majority, I think a lot of us have run into in our gaslighting history, doctors that don't know, but they won't tell you they don't know, you know? So,
right.
And that's just one of them.
Is just, sometimes I wonder with some providers why they got into what they do, because it almost seems like they have such a disdain for their patients.
Yeah.
Right.
So, and when he diagnosed me, he had tears in his eyes because it is a very grim diagnosis. And he said, "I'm really sorry." Oh, he said, "This."
I think I lost connection.
You're good.
I see you.
Am I back? Okay.
Yeah.
Okay. Everything just froze, so that's why I thought I lost connection for a second.
Yeah. He said, "There is no cure. We can just treat your symptoms. That's all we can do." Yeah. And he said, "So you're going to have to go into pain management." And, he was explaining to me that he couldn't treat my pain outside of the hospital because he's a DO, he's a nephrologist and an internist, and he can't prescribe. It's called loin pain hematuria syndrome, and it's the acronym LPHS. I can type it in for you.
And Sarah, why don't you, when you get a chance, follow Joleen, follow Mama, and that way you guys can talk about share stories and insights and stuff like that, because
for sure,
this would be incredible that if two people randomly through the crazy app of TikTok with this extremely rare disease actually have the same thing. That would just be blown away.
Do you have this, Sarah? I don't want to say that's awesome, but
no, it's not. But it just the odds, right, would be just.
Yeah.
She says, "I think so."
Okay. Yeah, get with me, follow me, and I'll follow you back so that we can discuss.
So it's boy, that would be a first for TikTok right there,
right?
Unfortunately,
not to sidetrack, but isn't it just one of the worst feelings in the world when they tell you that there's nothing that they can do for it? Like, getting a diagnosis is so important to us. Blunt with me, and he was kind about it, but he was like, "You're going to be in pain for." It's like one of the worst feelings to hear that.
It's like I was looking forward to finally getting a diagnosis because I thought as soon as they know what this is, they'll fix it.
Right. Yeah.
Well, that's the question I had for you regarding the diagnosis is, for me, in some things, and with others I've talked to who have, whether it's physical, like chronic illness, pain, or mental, or whatever, if they chase the diagnosis, and it's like what happens when the dog catches his tail, because they don't know what to do, and it's like all this build up, then they get it, and then it's like, no, what the hell am I supposed to do? Yeah. And so I appreciate you saying that for you it was a relief. It was momentous. But for some people, while it's important, they're like, I worked my ass off to get this, to figure this out, and
they're trying to get it.
It was a total letdown at the same time because they can't fix it.
Right.
Yeah.
And so to learn that I'm going to live with this for the rest of my life, it was a letdown. It really was. I was, and that'll lead me into what I kind of wanted to bring up is how when my husband and I have been married 27 years. And like I said, I met him when I was 15. And before I got sick, even though I've dealt with pain and different things, the endometriosis and the fibromyalgia and all of that, until I got my kidney disease, I was super mom. I was super wife. I took a lot of pride in taking care of my family. When I did work, I worked primarily from home. I raised my kids. I drove them to and from school. They did not ride a bus. I baked their after school snacks. Dinner was on the table at 5. My house was clean. And I'm not bragging, but this is what I took pride in before I got sick. I handled all the financials. So all my husband would have to worry about is to go, because he was our main provider. I wanted him to go to work and come home and be able to come home and rest and all of that. And we have always had a traditional type marriage, and I love that. And then when I got sick, I had to mourn. It's hard to explain. My husband and my kids had to mourn who I was, and to mourn who you used to be yourself, and then see the disappointment, like you feel like you're disappointing everyone. And my whole identity was mom and wife, and I loved it.
Yeah.
And that was just my world. My family has always been my world. So
yeah.
I wasn't able to clean as much as I used to, and I wasn't able to, and I managed the money, I paid the bills, I did all of that so that to take that off of my husband, because he works a very physical job. And it really affected. So my disease started a year before my boys came, my grandsons. So I was already dealing with pain in and out of the hospital, whatever. And then my daughter-in-law says, can you hang on to my kids for a couple months until I get my shit together? Because, my stepson was not doing great, and they needed to get a divorce and all of that. And so I was only supposed to have them for a few months. Then once I realized it was going to be longer than a few months, I had to go for guardianship and custody of them. It was a big thing because they were born in Utah and came from Utah, but I'm in California. And I had to go to court 5 times. The judge was so hard on me because they have a brother who is now back with their mom. And the judge was, and I said, well, anyway, my daughter was only 11 when these boys came.
Oh, wow.
And it wasn't supposed to be for a long time, but because I was sick and I would have times where I'd be in the hospital or I would be on the couch, I always made sure I got out of bed and I went to the couch. At least I was present. Even though I couldn't do much, I always wanted to be there. I wanted to be with them. I never wanted to just stay in bed. For me, that was important. At least I would be there with them. My daughter had to really step up at 11 years old. I would be in the hospital and my 11, 12-year-old baby girl was cooking dinner for everybody on her own, cleaning up after it. She was taking care of the baby. He was only 2. While I was in the hospital, she potty trained him one time. And so she, in a way, was forced to really grow up really fast because we had her nephews, and sometimes I was too sick to do what needed to be done for them. And so that was and it affected her. It affected her a lot.
Yeah.
She was the baby before, she was the baby in our family. She was our baby girl. My kids are far apart. So it's like they each got their time with me while the other was in school. You know what I mean? My son, he got to grow up with just me until he was 7. Mm-hmm. And then my daughter, my son was in school. And so she got to grow up with me. And so they got a version of me that these 2 boys never got.
Yeah.
And so, that the guilt is heavy. Mm-hmm. It's really heavy.
Joleen, just a second. I want to address, Angie just said she'd never come on this page because all I do is cry with the people in so much pain. Listen, we all do. We all do. This is an hour and a half to 2 hours live, right? But I've talked to Joleen for about an hour on the phone this week, right? And we've texted. Amanda and I have talked for quite a bit this week about this. When I get off of this tonight, it'll be 12:30, 1 o'clock before I can decompress. So I get what you're saying about how it impacts you. But there's 2 things going on here. One, Joleen gets to share this and gets to let her lose a lot of the weight that she's carrying because she's able to express all of this and get it out. And she's able to get awareness out for her syndrome. And the second side to that is we get to see other people who different illnesses, but we share so much in common with. And it's why we do it. The stories are powerful. They really, really are. It's because, in my opinion, they're invisible and nobody knows these stories.
Yeah.
And these stories, I don't think we're going to get change out into the world until all of our stories get out.
Yeah.
And so I'm sorry that make you cry. Just know that you're loved here. Nobody's going to be upset that I hit you like that because you're a human being and it's a painful story. So, and I'm not trying to call you out, Angie. I'm just trying to explain why we do it. There's my counter's working. We have 52 people in this room and we're an hour into this, right? It's because we want to be together to support Joleen and support each other. That's why we're here, is to let it down and let everything out. So, all right. I just wanted to make a comment.
Thank you for listening because, when you're a chronically ill person, you feel like all you ever talk about is how much you hurt and, I'm having a bad pain day or, having a rough day. And so to be able to just sit and tell my story and to feel heard is so healing in so many ways. And so thank you everyone for listening. It is going to get incredibly heavy. So I'm going to put a trigger warning. There was an incident and I'm working up to that. That was a very traumatic incident. And so before I get to it, I will put another trigger warning. I entered into pain management, and in the beginning it was, for lack of a better term, a shit show. Because nobody knew what I had. They had never heard of it. I actually saw the head of urology at Loma Linda University, and he saw me as a professional courtesy to my kidney doctor because there were surgeries that could possibly be done that may alleviate my pain or make it a little less. And he wanted me to go see this urologist. And this is a trigger warning before I say this. Trigger warning for, I don't even know what to say. I was insulted, and trigger warning for some bad language.
Don't worry about the language.
Yeah.
Trust me.
Okay. So after months and months and waiting and fight, because there are things that have been done for people with my disease that are very experimental. And one of them is called a kidney auto transplant. And it has helped some people. It has not helped others. And at this point, I didn't know that I wouldn't be eligible for it. But what they do is they take your kidney out of your body, they flush it, they reroute everything, and they put it back into your abdomen. They essentially are hiding it from your body.
Wow.
And it was not a very common practice. There was a doctor in Wisconsin that did it. He has since passed away. And he worked with a lot of people with my condition. And there's a team of doctors in Utah that did it. And it's not covered by insurance. And back then, we're talking 9 years ago or so, it would have cost me $100,000 per kidney. And
Wow.
that was a deal. At least in Wisconsin. I never even talked to the people in Utah. And I was so desperate. I was so desperate to be out of pain because now it's progressive, right? The pain gets worse and it continues to get worse. And so what I wouldn't give to go back to the first pain when it first started, what I wouldn't give to be that Joleen again, that's nothing. It's, I would almost put me on a negative 20 pain scale for that. I wish I could go back to that, but my pain continues to get worse. It is progressive. And so I see this urologist and he's like, I've never even heard of that. And he said, well, what do they do for it? And so because of all this research and the support group that I found, because when you have something that's rare, you don't relate to anybody because
Right.
nobody knows exactly what it feels like. And it's something that's so indescribable that it's really hard to explain to somebody the amount of pain that you're in. And I found a support group on Facebook and I was able to meet other people. And the very first person that talked to me, she and I are great friends. She lives in New Jersey and I love her. And one day we talk about it. She's going to come here and I'm going to cook for her and we're just going to lay around together and just, be spoonies together. And that one day that's going to happen. So I see this and he says, well, what do they do for it? And I start talking about radio frequency ablation that they're doing in the UK and auto transplant. And he was like, whoa, 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 whoa. And he stopped me and he goes, you need to see a psychiatrist.
Really?
Flat out to my face. And so I said, fuck you, just
Good
like
for
that.
you.
And I walked out. I was so angry and I would have never talked to another doctor like that. But it was so insulting to be told you asked me what they do for it because you've never heard of it. So I'm educating you, the head of urology at Loma Linda University. I'm educating you and now you're telling me to see a psychiatrist?
Yeah.
Good for you.
Yeah. No,
Yeah,
it is good for you.
I was angry. And this is after being treated like garbage, going to the emergency room. And when I have to be admitted, Biscuit, no, mind your business. Mind your business. When I have to go to the
Are you talking
emergency,
to a chihuahua?
I am.
You're telling a chihuahua to mind your business. You know that's
Yes.
useless, right? I've had chihuahuas.
I
They
talk to my
listen
kittens
sometimes.
the same way.
They listen sometimes. Biscuit, come here. Come here. Come here, baby.
You show me a chihuahua, I may end up on your doorstep stealing a chihuahua because I really want to know.
I'd love
So-
to see you with a little chihuahua, Keith.
I love chihuahuas. That's a whole other live
They're
that
all
we'll have to do.
chihuahuas or chihuahua mixes. This one is Biscuit.
Oh my God.
Oh.
Valerie, I'm going to California.
She
How
is.
can you not?
She has been a very difficult rescue. She has some issues.
That's fine.
We call them intrusive thoughts. She attacks.
She's a chihuahua. Of course she is.
Yeah.
So
But my
So you
smallest
told
one is 3 pounds, and she rules the house.
our yeah the smallest ones they do, and then the younger chihuahuas we've had always beat up on the older ones, and they let it happen, and they're just All right, so we
I've
got to
met
get up
9 of them. That's why I call them a mafia, because they are like these little gangsters.
Mine threatened to call MS-13 on me all the time when we had them. They did, And I'm not trying to be racist with that comment. Y'all live in Texas. I know MS-13. Anyway, it's all good. It's all good. Don't shoot me. But
What's the matter, Cam? She just said, guess you don't get seen or heard in here. I'm sorry.
who said that?
Jam.
Yeah.
What's going on, Jam?
What are we missing here? I didn't see
Sometimes
another.
we just got off on a tangent about.
Hello.
Howdy from North Carolina. Hey.
I'm sorry we missed that.
Yeah. Sometimes we get in the weeds with chihuahuas or with Amanda, the psychologist, that was her 2 dogs causing a fight, because the conversations do get really deep, and sometimes we need to kind of take a break for a minute. That's really all it is. We're not trying to blow anybody off or get off topic. I promise you. We've covered some serious stuff here already, and but on that note, so you told the doctor to fuck off.
Yep.
Good for you.
Yep. With my middle finger and everything. And I left, and I was so mad because, when I get admitted, I have to be admitted through the ER. So when I go to the ER, because when I'm in a flare, my heart can go into AFib. I can have seizures. My blood pressure is through the roof. And I only go, I waited 9 days to go one time, and my doctor raised his voice at me and he said, "Don't you dare ever do that again." He said, "This absolutely can unalive you." He said, "You cannot let your pain get to that point. Don't ever do that again." But the way they treat you in the ER is just...
Yep.
And
It can be ridiculous.
I would tell them, please call my doctor. Well, we have to do all our own diagnostics, and I won't give you any pain medication. They would say it like that. Mm-hmm. And I've had some horrible ER stories. So I went back to my doctor and I said, he's not going to help me. And I said some bad words to him. And so that's not going to happen. So, I find a pain management doctor who had never heard of my disease, but he was willing to treat my pain. And he's my pain management doctor right now. I've been with him about 8 years. There was a break in there, and that's where this story is going to get pretty, there's going to be a huge trigger warning to it. Because that pain management doctor, I was at the 90 MME, mm-hmm. and my pain was not managed. Mm-hmm. And he said, you really need a pain pump. And he said, I really think that you would benefit from it because it'll be a continuous, because I metabolize fast, and so he referred me for a pain pump, and I wanted to see a certain doctor because he was the best of the best, but he didn't take my insurance. And he finally agreed to see me with a letter of something, some financial something from my insurance. And then at the last minute, he backed out, and I don't know why. So at this point, I am desperate. I am desperate for my life back because I spent about 4 years on my couch.
Wow.
Debilitated. My daughter, who's still a child, has all of this responsibility because, obviously the boys are still here. It wasn't a few months. And so she, in a sense, was really sacrificing a lot of her childhood to have to help me.
Right.
Yeah. And help take care of her nephews, who are really like her brothers. Mm-hmm. So as I'm, still seeing my pain management doctor, trying to find a doctor to do a pain pump, and I saw several, and they were like, "Oh no, we don't do that." And I'm like, "Why am I here then?" I get a call one day from a random doctor's office saying they had a referral for me to come in, and could I come in that day? They wanted me to come in that day, and it was 4:30, and I said, "Well, I'm about 15 minutes away." "That's okay, we'll wait for you." I said, "Okay." So I go in and I talk to this doctor, and he's charming, and he's younger, and he's animated, and he knows my current pain management doctor. And at that time, I was taking 3 Oxy ER a day, extended release, and 3 oxycodone a day, immediate release. And he said he knew my doctor, and my doctor is very conservative with pain medications. He doesn't just dole them out. And he said, "Well, if Dr. Strum is providing you with that much, then you must need a pain pump. So we can get you for a trial," and blah, blah, blah. And I felt just very rushed. And then he scheduled my trial, and I went down there, and it was about an hour away. Needed my husband to take the day off work. We took our 2 boys down there, and they can't do it because he forgot to order the medication. And it was just a constant and so these are the red flags that I should have seen, but because I was so incredibly desperate to return to some semblance of who I used to be, I ignored these red flags, which is not like me.
Right.
After 4 months, and he only did these things once a month. He was at the surgery center once a month. So I'd have to wait a whole new month. Next time, they don't have my information. They really didn't book my appointment. Next time, couldn't find me, didn't order the medication. So 4 times I had an appointment for 4 months, one after the other. And during this time, I can't see my other pain doctor because I'm now under his care. Right. And he has me on Suboxone. And so because I was on Suboxone and it was doing absolutely nothing for my pain, I was more and more desperate to get help because I was completely debilitated.
Of course you were.
So I finally get the trial, and I don't even remember because all he did was inject some medication into my spinal fluid and asked me if it worked. And I said, yeah. I don't even remember if it really did. Right. I just said, yeah, it worked. Cool. Let's go for it.
Right.
So I went in, and I finally got this pump. It's in my back. And I will say that in the beginning, it really did help me. And this is where I'm going to put a very big trigger warning. If you are easily triggered by extreme trauma, please scroll out. I just want you to scroll out. So the first time he filled it, I was fine. The second time he filled it, is that my husband leaving? I can't listen to this part, but I'll come back in a bit. Worst day of my life. Second time he filled it, I drove home, and I felt weird. And for someone who had never felt euphoria before, I knew something was up, and I took a picture of my eyes. I was loaded. And something had happened, and I got a very large dose of the medication that starts with a D.
Oh, wow.
And I was home, and one time my friend drove me to get my pump filled, but every other time I drove myself. And because it's in my back, I can't see what he's doing.
Right.
Knowing now what I didn't know then, I should have never let this man touch me. He had a packet of baby wipes, and he would take out a baby wipe, wipe my back with it, and stick a needle and fill it. So I had driven home, and my kids were already here at home, and I felt weird. And so I told my husband, there's something up, and I sent him a picture of my face, and he was like, yeah, you need to call an ambulance. So I went and I explained to my boys, hey, you guys, I'm fine. Don't be scared. I'm worried about how they're going to feel about fire trucks pulling up.
Right.
Yeah, starts with a D, ends with a D. And so the paramedics come and they check me out and they take my vitals and they said, you're okay. You got a little too much of your medication. Maybe some of it spilled, but you're getting enough oxygen. Your breathing's fine, whatever. But I just felt so weird. That night, I was like freaked out, afraid to go to sleep. My husband was afraid for me to sleep. And the next day and the only way to get a hold of this doctor was to text a cell phone number or email, because they never answered the phone and you could never get a hold of him. And I learned early on, emailing this man, I have a trail. Mm-hmm. I have, I think Amazon is here, so it might get real loud for a second.
It might. With not that many chihuahuas.
I'm back in my bedroom with a few of them, but the rest are out there. And if someone has the audacity to come to our house, yep, Amazon is here. So they're gonna, hey, nope, mind your business. So, anyway, I forget where I was.
You had gotten too much medication.
So and you didn't want to go to sleep that night because of how you're feeling?
Yeah. And my husband was worried about me going to sleep because I didn't know what was going on, and I was afraid maybe I could overdose or whatever. And so the next day, my husband drove me down to his office and I said, I don't know if you turned my pump up. I don't know what happened, but why did this happen? And he said, could be something with the pump. Let me look up if there's any recalls. And he really just kind of blew smoke up my rear end to shoo me off. It was a very strange interaction, and my husband was there with me for it. And that was in July of 2021. Now we're going to go to the heavy part. October 4th of 2021, I went to get my pump filled. And he would I couldn't get a hold of him, and he kept forgetting to order my medication. My pump would be beeping because it's empty inside my body. So, October 4th, 2021, I went to get my pump filled. And this doctor in particular, he always had students, and these students would write prescriptions and he would just sign them. I mean, it was a crazy operation. And he was teaching another doctor. And so I remember when I walked in, I had a t-shirt that said Jesus is King. And he talked about how he loved my t-shirt and this is how he would greet me. What's up, Joe? Cutie patootie. How you doing? I mean, that's how he was. He was just, so he was teaching another doctor, and he stuck the needle in my back and he said, now we have to aspirate, because if we aspirate and we see blood, that means we're in her subcutaneous tissue and she's going to go home and overdose and die. Those were his words, exact words.
Oh my God.
So he filled my pump. I left immediately, drove myself home. I was on the phone with my sister, and I didn't realize that something was happening. And I let all my dogs out, and I count them as they go out and I count them as they come in so that I can make sure that they all come in. And I kept counting them over and over. And my sister said, why do you keep counting your dogs? Does everybody do that? And I said, don't they? I just want to make sure they keep coming. They're all in. Hung up with my sister, but she noticed something was a little bit off. I talked to my friend Sophie driving home. And I have all my phone records and everything of this. So Then I talked to my husband at 12:30, and at this time my daughter was 17. She worked at McDonald's, and she worked a lot of nights, so she would sleep, half the day. 17-year-old, sleep. She graduated high school early, and she took junior and senior at the same time, and she graduated early. So she was working at McDonald's. She would sleep half the day. 12:30, come home. She's still sleeping. I talked to my husband. And he said I sounded a little off, but because of the last time, he wasn't really concerned because it was just, I was fine. He said, well, if you don't feel good, if you don't feel okay, don't drive. And this is the last thing I remember. I said, I'm not driving, I'm at home. At 2:00, my daughter got up and she was like, where's my mom? She noticed my truck was here. I was in the bathroom and she opened the door and I was completely gone. I was not breathing. I had no pulse. My heart was not beating. I was blue. Lips were blue. She said she could see the veins in my face. So my 17-year-old baby called 911 and I was sitting on the toilet, but I was leaned up against the wall. And she pulled me off the toilet, 911, and I'm a big girl. I'm a bigger girl. And she was trying to, I fell face first, and they were telling her to get me on my back. And she tried with everything she had to try to get me on my back, and she couldn't because it's complete dead weight. She reached around and did a sternum rub, and she said she heard a death rattle, and she heard that sound.
Oh my God. And she's 17.
17 years old.
Your daughter.
Yes.
And she's hearing that with her mom.
Yeah. She found vomit in the laundry room. I don't know why I don't even remember why I went to the bathroom. So they were here in 4 minutes, and it was the fire department. Thank God it wasn't our local ambulance company, because I wouldn't be here if it was them. And they immediately came in. My daughter, now I do have the Ring video of when they got here on my TikTok, and it's pinned. It is very hard to watch and hear, but it is just kind of validation that this really did happen to me.
Yeah.
I think I saw that actually.
Yeah. She opened the door and they're screaming. So they didn't know what was wrong with me. She told them I was diabetic, which I'm not, and they gave me glucose and that didn't do anything. And in the video, you'll see does she take any medicating? And in the video, you'll see does she take any medications? And she's like, yes, she has a pain pump in her back. And she called my husband and she said, Dad, I just found Mom. I think she's dead. And then I can tell that he said, what? And she repeated it. They administered, yes, it is. It is pinned. They administered 5 doses of Narcan, which this is another thing I've since learned. They will usually, in some areas, they will only give you 3, and that's it.
Some areas in Vegas, it's 2.
Immediately started CPR. I was CPR in progress the entire way to the hospital, and CPR when I got in, and they put me on a Narcan drip.
Wow.
I didn't wake up for 24 hours.
Oh my God.
And when I woke up, I had no idea what happened. No idea. And I wasn't in the hospital I recognized. I didn't know where I was. I didn't recognize the hospital. And so I was having anxiety and all of this, and I was freaking out. And when my husband got to the hospital that day, they wouldn't let him back. And my husband's a big dude. He's a big guy. And he was on the phone with my mom, and my mom called my sister and said, they're not letting Martin back. And my sister, Kylene, said, he'll get in. And my mom's like, they told him he can't go back. And my sister said, he's a freight train. He'll get in. And they were, threatening to call the police on him and all of that. And he made it back and he saw me. And, nobody knew exactly how much I got. Nobody knew, how bad it was. Because I was not breathing for a period of time, I do have an anoxic brain injury. My heart was severely damaged. So I'll be on medication for that for the rest of my life. And the pain management doctor that would normally treat me in the other hospital came to see me. And he said, I need you to come to my office. And I'm going to empty your pump, because the pump manufacturer came and turned it off. They came into the hospital. Now, this doctor spoke to my husband on the phone and told him that he was at the hospital and that I was doing okay, that he came to check on me and I was doing okay. He told my husband that. My husband said, go back and check on her. I want you to go back and call me back. And he never called my husband back. That doctor has no privileges at that hospital. He was never there.
Oh my God.
And he was trying to get my husband to authorize me to move me to Loma Linda University, because he wanted to take the pump out and replace it. He said it must have been a pump malfunction, blah, blah, blah. And my husband said, no, she's staying where she's at. They're taking good care of her. She's staying where she's at. My mom called that day that it was all happening and said, you need to call him. This is happening to my daughter. And they said, we can't get a hold of him right now. And my mom said, this is malpractice. My mom worked in law, her whole adult life. So when I woke up, I didn't know what happened. I was scared. So they did a bunch of tests on my brain and all of that. And I went home after 48 hours. I went home after all of that. Wow. So then I went and I saw the pain management doctor that I trusted, that had treated me before. In his office, I paid cash because he didn't take my insurance. He offered to see me for free, and I wouldn't allow that. So I paid $150 to see him. And he put me in his procedure room using x-ray to locate my pump, to try to drain my pump. It was completely empty.
So it had just leaked into you, basically.
That doctor missed and put 3 months of D into my subcutaneous tissue. So when it's in your subcu, it slowly disperses. It doesn't happen all at once.
Thank
so
God.
it was a process. So from 12:30 to 2, we don't know how long I was actually not breathing. We don't know any of that. There is zero medical explanation as to how I survived. Now, I believe in God, and this is just me giving glory because of my beliefs. I am here because he knew that I needed to be here for my family. He wasn't ready for me to go home yet. I needed to be here, and I am a walking miracle, because even a few drops can cause an overdose that requires naloxone. I got 3 months worth. So, I don't use the pump. It is still in my body. I am going to have it removed. But I'm not in a hurry. Thank you, everyone, for all of your kind comments. But that is the heaviness of my story. I also wanted to discuss, because I don't know if anyone else has experienced this, as far as how that you get treated. In the ER one time, I was, a doctor refused to call my doctor. The ER doctor refused to call my doctor and left me in the waiting room, constant vomiting, because when my pain gets so bad, I start vomiting and I can't stop. Left me there for 13 hours until shift change, sitting in the ER, and you can't take your medication to the hospital. So you go there with nothing because you're not allowed to have your medication in the hospital. And I was doing what I was supposed to do, left my medication at home. Another time, I was a cigarette smoker back then. At this point, I'm not anymore, but at this point, I was a cigarette smoker. I got up in the morning and I went outside, walked out to the street with my Heplock IV, and I had my cigarette. And when I was walking back in, I popped some gum in my mouth from my purse, put two little, pieces of gum in my mouth, and went back to my room. 3 minutes later, I'm being swarmed by nurses accusing me of popping pills when I'm there for pain management. They searched my purse, went through all of my belongings, accused me of double dosing. Another time, I had a nurse call social services on me because I have children. And she said that I drive my kids to school every day all hopped up on pain pills. And that nurse did not like me because she called my doctor and said I was a drug seeker, and my doctor ripped her up one side and down the other and said, "Don't you ever say that about my patient. If you had her diagnosis, you probably wouldn't be here." A lot of people that have my disease, they unalive themselves because they can't get help.
Yeah.
So that has I am back on oral medication, and I am back with the doctor that I trust. And it's been a long road, and I know I've just been talking. So
No, don't stop.
Yeah.
This is why I asked you on. I didn't ask you on to trigger anybody. I didn't ask you on to trigger yourself. I didn't ask you on to have to relive hard things. But we talked about when you bring it up, it's difficult. But you will feel. I promise you, maybe tonight or tomorrow, you're gonna be glad you shared. Okay, I promise you, or we wouldn't do this.
I'm glad I shared. I feel comfortable.
Good.
I feel comfortable. And the whole reason I joined TikTok was to tell this story. And that's how my videos, and then I found all these awesome people in our community. And
this community is a lifesaver. I don't care
amazing.
what people say. This community is a lifesaver.
Support groups, and it is life saving to feel community when you are sick.
Yes.
Yeah, it is. It's life saving to me to know I'm not alone when I have to deal with this stuff. It's invaluable. That's why I do everything I can for this community. That's why I answer my messages the best I can in the comments. That's why Amanda's here. That's why we do all this stuff. And that's why we even put stuff on YouTube. Like this will be on YouTube hopefully by midday Saturday because there are people that wanted to attend that can't. So we put it on YouTube so people can see it. And, but I want to get to. I don't want to leave anything out that you want to share, but I also want to get to where we talk about our partners and your husband, because that's something in all the stories that we've heard, we really haven't gotten to that yet. And I know it's been late and everybody's, but that's an important thing. But like I said, I don't want to leave anything out that you want to talk about, but
that's pretty much it in a nutshell. I mean, I have a gazillion stories like we all do of how we've been treated by providers. I've had pharmacists refuse to fill my medication. I've had nurses refuse to push my medication in the hospital. And so, it's same thing, different day for all of us. And you get angry. And when I get really, really mad, I cry, and I hate to cry. And it makes me so mad that I'm crying because I'm mad, And I would like to say I'm a strong person. I can endure a lot, but there are some times where we just feel like, when is enough enough?
Yeah.
Yeah. I wanted to bring up how it affects marriages and children and families, but specifically marriages, because, and I'm going to be really vulnerable here. Are you okay, Keith?
Yeah, I'm good. I'm good.
Like I said in the beginning, my husband and I met my husband when I was 15. He was 17. We have a marriage and a relationship that when others are looking in, they can't even. They always say that's what I want, and this is not me bragging because, of course, my marriage is not perfect. There isn't a perfect one, but we've always had a very close bond, love. We are soulmates. You know, we just have always loved each other completely, and no matter what we went through it. But when I got sick, it affected my marriage.
Absolutely.
And
Yeah.
because my husband, you know, he builds race cars. That's his hobby. He's got tons of really great cars, old classics that are all raced out, and that's his hobby. And so in his brain, his mechanical brain, he's like, if it's broken, fix it. You know, if you're broken, they need to fix you. And
Yeah.
him always being the provider and me handling everything at home, if I'm in the hospital, he can't go to work. And so he's got to step into my shoes here. And he required a lot of help from our daughter. And I don't want to leave my son out. My son, of course, helped. He drove kids to school. He did everything because he was still living here at home. But my daughter really stepped in my shoes as a very young teenager. So it really affected. And when I would be in the hospital for a long time, he would be frustrated because he's like, you can take medicine at home. They're not doing anything for you here. You know, and of course, you know, they want you to stay another day and another day because they want me to be stable when I go home. And so it was a source of contention between us, not because he was trying to be, like not caring and not have empathy, but because he didn't understand. Right. He didn't understand my disease. And so when my doctor would come in and my doctor would talk to me with my husband there and try to like bring things up to help him understand, because he knew that my husband was really struggling. And the time I finally found a support group on Facebook, it was one night and I kept talking about how much I hurt and how much I hurt and how much I hurt. And my husband said, baby, can we talk about something other than your pain? And again, he was not being insensitive, and I'm not saying anything negative about him because my husband is the best man I've ever known in my entire life and I'm obsessed with him. It was that was all I talked about. And that's when I realized, like, I need to talk to somebody that understands.
Yeah.
That understands what I feel.
Right.
And so
I've preached for a long time on here, a couple of points, like everybody make sure you get your medical records and everybody make sure you have somebody to vent to. And
Absolutely.
It doesn't necessarily have to have somebody that has all the answers, just somebody to vent to.
Right.
And preferably if it's somebody that can understand what pain is or what an illness is or something like that. But that's what this community
suffers. My husband has a really messed up back. I mean, he's got a really bad back, and he's gone through all the injections and everything, but he's got Kaiser, and they don't really treat pain with medications. They want to just stab you and poke you and all of that, and it doesn't work for him, so he doesn't want to do that.
Yeah, we have family up in Washington State, and they have Kaiser. They worked for Kaiser, and now they can't get the pain meds that. Yeah.
So, and it's not that he was completely, a stranger to pain. He was very aware of what pain. He feels pain every single day, and so, but he doesn't know my pain, just like I don't know his pain. It's completely different. So that was, that it, a lot of things changed in our marriage. There was a lack of intimacy. There was, I never wanted to go anywhere, do anything. I didn't feel good. And we've always, all of our marriage, we go on dates. We've always made it a priority, because our marriage is what started this whole family, this beautiful blessing of a home that we have inside these walls. It took a really hard toll on our marriage. And again, not because he was being an insensitive jerk, but because he saw his wife that used to do all these things, and now she can't. And it was very hard for him to grasp that.
Yeah.
And a lot of people that I know in my support group that I found on Facebook, their marriages fall apart.
Yeah.
Yeah. Well, Miss Whiplash, she's here right now, and she was on last week. And again, I don't think I'm talking out of turn, but she was in ICU, and her husband went hunting, right?
Yeah.
So it can take a hell of a toll, and so.
And, the house wasn't as clean as it used to be, and the laundry would back up.
Yep.
The one thing that I have held on to this whole time is that I'm a really good cook, and it's how I show my love. And so I cook for my family. So, I always cook a meal, even when I'm in horrific pain. If I can't do anything that day, if I'm having a horrible day, I want to save my spoons so that I can cook for my family.
Yeah.
Because that's like one thing that I didn't lose.
Right.
Yeah.
I still have that talent that I had before, even though, I hurt and I'm different. But I think that a lot of support also needs to be given to spouses and partners. And when they have, especially someone that when they married, they were perfectly fine. Other than the endometriosis and, the horrible periods, I was perfectly fine.
Yeah.
Yeah. And that was the hard thing for him. It really affected him to where he and I had a complete breakdown in communication, because I would always just be on the couch watching TV. That's what I did, and because I couldn't do anything else. And he would try to sit here, but my husband and I are completely different. He always has to be doing something. When he's constantly moving, his back doesn't hurt as bad. As soon as he stops, that's when he hurts. And so it was really hard for him to sit with me. And, we've come complete full circle. It has taken a lot of hard work and communication and pain between us, emotional pain, because from my perspective, I feel like he just doesn't know what it feels like to be me. How could he feel like I'm failing at things when he just doesn't know what it feels like to be me? Well, I don't know what it feels like to lose who he used to be. I don't know what that feels like. And so when I really put myself in his shoes and he put himself in mine, there was a lot of healing that was done. But I just feel like, our caregivers, our spouses, I just feel like they just need a freaking high five, man. Like, a good job. Thanks for staying around. You know what I mean?
Yeah. Because it's not easy being with somebody who's ill.
Mm-hmm.
It's not. And I asked him if he might be willing to come on and talk about it. He's not really a talker, but I just feel like his perspective would be awesome.
Well, that's going to be a Tuesday night thing that we put together, because I want to keep Thursdays for Invisible, but I want to do a Tuesday night where it's spouses or its kids or its friends or its whatever,
Yeah.
so they can talk about honestly. Well, make sure they talk to their partner first,
Right.
but honestly talk about the struggles, right? Not to make people who are invisible feel bad, but to give us a better perspective of maybe things that we could alter. Or like with Valerie, I try, if I know I'm hurting, I'll try to let her know, right? So I don't just blow up, but I suck at letting her know. And she's pretty good at reading me, but I try to do that not to whine and bitch about the fact I'm hurting, but so just to let her know, hey, I'm hurting. My fuse is like really, really short. So if something goes wrong, I'm going to explode, to let her know that it's not necessarily that I'm angry, but it's the fact that my mind can't process it like it should. And those are hard conversations. And I want to have a talk on a Tuesday night where we have people who don't have a spouse or a partner, and the struggles they go through, so they can share that. So all of us that are lucky enough to, we have a better understanding of what our brothers and sisters in the invisible community that don't have that kind of security net. Because a lot of the conversations we have, my point in having them and wanting to have them is so we understand each other better.
Yeah.
So there's not a situation. I think that a lot of rhetoric can be cut down in the community because there's a lot of stuff that goes on in the pain community that pisses me off. I think it's based on misunderstanding or lack of knowledge. And that's why I try to have the conversations we have, so we can understand each other better and be more compassionate and take a deep breath before we make a stupid, smart ass comment, and not even think about it. Right.
Right.
Does that make sense?
Yeah.
And I'm not a therapist. Again, what it is the only license I have is the license to drive. Right. And, but I think nobody needs a license to have a conversation to get to know each other better.
Right.
So.
And my daughter might be willing to come on and talk about what it's to have a sick mom.
She's 11 years old, and you're in the hospital, and she's making dinner for Dad and everybody else in the family, right?
Yep. And then cleaning up after it and waking up with the baby. And I mean,
I think that's we need to hear from people like that.
Yeah.
And again, it's not to shame people who are invisible. It's so we get a better understanding of the situation that they're living, right? And how what steps can we do to make it better? We may not solve it. I'm still going to have a short fuse, and I'm not going to tell Val or warn her ahead of time. It's still going to blow up, right? But to have a better understanding.
Yeah.
So is really kind of what I'm thinking. So, and
I have
anyway,
people that would love to do that. They keep asking to come on my lives, and I'm like, I don't know if I'm ready for that yet.
But because it'll be a hard conversation.
It is.
If you're sitting there and your spouse is sitting next to you on their phone or in another room on their phone, even, right?
Yeah.
It's going to be hard stuff to hear.
Yeah.
Yeah.
But at the same time, it's important stuff to hear. And when we have people on that don't have the spouse, that are having to deal with it with themselves, I'm going to feel like shit because I'm going to be sitting there going, my God, I am the luckiest person on the planet. How are these people doing this? Right? It's not going to be easy, but I need to know so I can be better.
Right? I think as much as it sucks to be us, right? Like and I say that kind of lightheartedly, but not as much as we suffer, as much as it sucks to be chronically ill and live in chronic pain. I just feel like it's important to recognize our loved ones and how much it sucks for them too.
I know. I think so. So,
Yeah.
all right. You guys are awesome. I need to get some meds.
Right.
I
Yeah.
need to move.
So,
I need to move. That's the downside of being a chronic pain patient that has incredible people on to talk to. We have 50 people on, and we've been on here for about 2 hours because these people, this community is that awesome.
yeah.
This community is that awesome.
I always say my dogs are my people, but I found my people on here.
Right.
You know, this is just what this community is. And I am so blessed. And I'm going to do, we hit 60,000 likes tonight. That's like a brand new record, you know? So,
I think people sent me gifts, and I've never been live before. So if anybody sent gifts, I thank you.
I'll tell you how. I can help you with that.
I'll re-gift them out.
It's KEITH_N_Texas. No, just joking. I can help you with that. But you deserved everything you got, so we'll make sure you get it.
Yeah.
Thank you guys so much for having me on. Thank you.
Amanda, anything from you before we abruptly end this? And I hate to abruptly end it, y'all, but I got to get up and move.
It's all good.
So
I just want to say thank you guys so much for staying with us tonight, and we really appreciate y'all and love y'all and want you to know that you're seen and heard. And yeah, meds sound good right now, so
I'm right there with you guys.
any
It
final
always
words?
ends up where it's due, like right around this time.
Yeah.
You know,
Yeah.
Jolene, you got anything?
Thank you for listening.
Thank you for coming on and sharing and being open, and because it's not an easy talk, it really isn't, but it's worth it in the end. And for Amanda, again, always thank you for everything you do and getting this psyched up and getting this and making sure it works. And Dixie and Karen in the mod room, thank you.
And thank you both for what you're doing here. I think this is profound.
Thank you.
This is pretty awesome, isn't it?
It really is.
This was awesome.
Strength in numbers, y'all.
We just another great night. I'm going to have this up hopefully by Saturday early afternoon. I have an extra subscriber tonight. I think I picked one up. Y'all, the subscriber for me, we're going to go, I promise you, to Petco. Once at $50, we're going to go to Petco, and we're getting treats for all the dogs in the shelter because they're forgotten just like us. And it just energizes me to get the stuff on YouTube. And we're going to work on all, Dixie's going to help me get like different graphics for people all this cool stuff. And I just appreciate it. But more importantly, I appreciate everybody being here tonight. This means Thursday nights mean the world to me. And this community means the world to me. If there's anything I can do for anybody, send me a message. I may not answer tonight, though. Maybe sometime in the morning. But
It goes for me as well.
you know, just send us messages. We're here for you. And that's about all I got. So y'all be safe. And we will see y'all. Oh, Sherry, thank you. We will see y'all next Tuesday for sure. All right. Y'all be safe. Talk to you soon. See ya. Peace.
Bye.
Bye.